all start. The idea of being under general anesthetic and having one doctor flipping through a manual trying to figure out how the hell to use the devices scares the shit out of me. And it points to the need for this kind of software, right? The other thing that I thought was, when you talk about, you kind of look at, okay, does this thing need to be in VR? And a perfect example that I would use to say yes is that you saw the toolbox with all the different size tools. Like the other day I was putting together a wheel stand for a racing wheel, and they had 8 different kinds of screws, and they had pictures of them, and the measurements of them, but it wasn't clear. Is this the smaller one? Is this the longer one? Like which one goes in which thing? And having a VR instruction manual that shows me exactly it's this one of these 8 different kinds of screws that goes in this spot would have been so much clearer, because I can get around, I can see, oh, here's how I'm going to install it. And I assume it's the exact same thing when you're doing surgery on a body and you need to see where does this particular thing go. So I thought that was really impressive.
Yeah, I think awesome, actually. First of all, you're an accomplished surgeon and you're a business guy and you understand the technology. I mean, I know a lot of doctors and very few of them can even balance a checkbook. I mean, so I'm serious.
Can't do that.
I mean, this isn't no, you got a big opportunity here because there's a very small, piece in the Venn diagram of people that have that kind of skill set. So I think you're set up. So tell me where you guys are in terms of development and deployment. How are you gonna get this out to the medical device companies? I totally get why they want this, because this is what they do. They have to train. They have people all over the world training physicians, and this is why medical device companies tend to ramp so slowly, because they can't get people. First, they have to get device approved, and this would probably help in the approval process because you can educate people much faster. But where are you in the cycle?
We're in early talks with several top 10 medical device manufacturers. One of the challenges of VR is it's very hard to explain to people what it's like and the incredible benefits that it has. And in the medical markets, very few people have been exposed to VR so far. Some of the companies we've spoken to have actually people dedicated to kind of frontier technology division, so it's been good to work with those companies, and things are moving a bit faster with them. So the next steps is basically we have to sit down in front of all the decision makers with our demo and have them actually use it, and that's really our next step, and we have that coming up.
Because VR is definitely, you have to get under the hood. Otherwise, it's like when you see like yesterday, we saw a preview of some of these videos, and they're, you're seeing them on a 2D screen, and you're thinking, does that really need to be in VR? Then I went across, and you can see all these demos over in the VR area in the exhibit hall, and I saw something. I go, okay, yeah, I get it. This is a really useful thing in VR, but you don't necessarily get that from seeing a 2D presentation. So I think you're totally right.
I think what you guys are going to need to do is actually spoon feed it though to these doctors. You can't just send them a link and the software and expect them to put their own VR system together. I think you're going to have to figure out a way for deploying this in kind of a complete system level.
Oh yeah. We're going to take care of the hardware parts and deploy the stations on our own. Yeah. It's going to be very plug and play on the doctor end.
So from a business model standpoint, you talked about going to the device manufacturers. So is your model that you're going to sell them kind of a system that they can give to the doctors that are doing the particular surgeries using their particular devices?
We're a software company, and we have a product that we customize for our device manufacturers, but ultimately they're publishing their modules on our platform. So it's going to be a licensing-based model.
That's very smart.
Hey, this is great. Thank you, Justin.
Thank you, guys. Thank you very much, everybody.